Some doctors at Community Regional Medical Center are serving their country and getting valuable experience at the same time through the University of the Pacific Arthur A. Degoni School of Dentistry residency program. Community Regional is home to the only Level 1 trauma center from Los Angeles to Sacramento. And the hospital teaches more than 200 medical residents a year, including oral and maxiofacial residents from the David Grant U.S. Air Force Medical Center from Travis Air Force Base near Fairfield, California. Meet a third-generation military captain and Travis resident who is learning all he can at Community Regional to help serve his fellow countrymen and women.
Dr. Gregory Bell, captain of the United States Air Force and oral and maxiofacial resident, joined the Air Force while he was in dental school.
How are you feeling? I spent about a month down at Walter Reed Army Medical Center with the oral surgery department there. And at that time, they were treating a number of young servicemen and women coming back from the war. And I said that after that I definitely wanted to be an oral surgeon, and I definitely wanted to be an oral surgeon in the military. So it was a good experience, and signing up for 9 years was not a problem after that.
Although David Grant Medical Center operates the second largest graduate medical education program in the Air Force, it is not a Level 1 trauma center with specialists that treat serious life-threatening injuries 24 hours a day, 7 days a week. So medical residents from the OMFS surgery program come to Community Regional to get the experience they need.
That is extremely valuable experience for us, not only as doctors, but especially as doctors in the military, where we may very well see these injuries again.
Oral and maxiofacial surgery is a combined specialty of surgical and dental expertise that requires extensive training.
Out of our 4-year residency, we spend 9 months in Fresno doing oral surgery, where much of the oral surgery we do is related to trauma. We spend 2 months on trauma surgery service, and then a month on neurosurgery.
These are images from Rebecca.
Thank you, Colleen.
Dr. Gerald Alexander is one of several faculty members who oversee Travis residents in addition to their own Pacific residents at Community Regional.
Wherever they might be, they're going to be taking care of people with injured facial wounds, and we want the highest skill level as possible. And in Fresno, we're a Level 1 at Fresno Community. We're a Level 1 trauma center. We take care of a large number and variety of facial injuries. We take care of broken, fractured jaws, fractured faces, facial bones, extensive lacerations, infections, along with elective cleft palate and skeletal facial deformities.
With a shortage of specialists in our region, these doctors help bring a higher level of care to area residents.
It's a very mutually beneficial program between us and Travis Air Force Base residents, in that we get the added help with patient care and call, and they get to get involved in the large variety and severity of facial injuries that they get to treat.
Since he is one of several OMFS surgeons who are on call at Community Regional, Dr. Alexander has worked closely with Dr. Bell on several cases.
Yeah, this is Dr. Alexander returning your call. Is the patient ready? Call is 24 hours a day for the week that you're on, and we're on frequently. So as you might imagine, facial trauma comes in at any hour of the day. We try to do as much of it as electively as possible, in which we'll take a certain number and put them on a certain day, but many of them are injuries that won't wait, so it's not too uncommon to go in the middle of the night and take care of these.
Dr. Bell appreciates the help of the attending surgeons, especially Dr. Alexander.
He's great to work with, and his knowledge base is very vast, and he's a great teacher as well. So learning from him is definitely a treat. And we do work with other attendings down here that are all great.
Dr. Bell is not sure where he will be stationed after his residency at David Grant is complete.
It all depends on the needs of the military at the time. If I get deployed, I'll be happy to go. You know, it'd be an incredibly rewarding experience.
Even though the residents come and go, Travis residents are always a welcome addition to the trauma team.
You bond with them. You kind of hate to see them go. They're usually here for 2 months at a time, and they become one of us, and it's hard for us to think of them as not being one of our own residents.
Dr. Bell agrees.
They're all just, great surgeons. They're great attendings. They're great teachers, and I've learned a lot from all of them.
The residents are a valuable asset for our patients at Community and our military. For information on Community's residency program, log on to medwatchtoday.com.